Hi, so I'm Isabel Roos. I work at the college as the Member Support Officer. So I'm basically the conduit between the college and the hospitals. So I do the basic training orientations, and I can come out to the hospitals and meet with you guys and do one-on-one sessions to talk about prep tools, the portal, training requirements, any issues you have, and things like that. I also support the New South Wales and ACT Trainees Committee, which advocate on behalf of you guys in regards to things like training, assessment, supervision, and your whole general education experience. On your chairs, you should have a flyer for Converge, which is the college's 24/7, 365 days a year professional and confidential counselling service for both workplace and personal issues. There's also an app called EAP Connect, or if you just search for Converge in the App Store, it'll come up. That has all the contact details for the support service, articles on a few different things like strengthening work relationships, coping with uncertainty, and then also a few mindfulness activities. So it's a really good app to have on your phone. You'll also have a flyer for the Trainee Research Awards, for which applications are now open, and this is your opportunity to practice presenting on your research to your peers. That's a really good thing to try out. We also ask that you please complete the evaluation form that you should have as well before you go today, and leave it with us, just leave it on the table there. It really helps us to make sure that we're giving you good value with these kinds of events. All right, so I'll hand over now to Dr. Phoebe Stewart, who is an advanced trainee dual training in endocrinology and general peds, and is also the co-paediatrics chair of the New South Wales and ACT Trainees Committee. Thank you.
Hello, I really don't need any applause. So thank you to everyone who's come both to Sydney Kids and who's linked in with the video conference at the Children's Hospital at Westmead. I'd just like to start by acknowledging the Gadigal people of the Eora Nation as the traditional custodians of the land on which we meet today. I pay respect to elders, both past and present, and any Indigenous people who are with us this evening. So again, thank you for attending. So this event is the first time we've run this paediatric-specific event, and it's been run in recognition of the difficulties that trainees face sometimes in transitioning from basic to advanced training in terms of completing requirements and completing training in a timely way. So I'd like to thank our three speakers for the evening, Dr Hala Katf, Professor Nick Wood, and Dr Nogajski. So I'll introduce all of them as they come up, but just ask you to not ask questions during or after the presentations, and to save all your questions for the Q&A panel at the end. Excellent. So welcome to our first speaker, Dr Katf. Dr Katf is a general paediatrician at the Sydney Children's Hospital and is the Deputy Director of Medical Administration at SCH. She's also the immediate past chair of General Paediatrics Advanced Training Committee, so she has an intimate knowledge of the requirements and processes for General Paediatric Advanced Training. So please put your hands together to thank Dr Katf.
No worries. Thank you. Thanks, Phoebe, and you don't have to call me doctor or anything. I'm just Hala, as everybody knows. So yes, and I do elate the fact that I'm not the chair anymore. Sorry, Lydia. So Lydia's in the audience. She's actually now the chair of the General Peds Advanced Training Committee. So we've had a lovely transition over in roles. First of all, I just want to say congratulations to everyone over the other side as well. And it's a big slog for everyone to get through the exams, and now you think it's all over, don't you? But wait, there's more. So the important thing to know is that you've got to make sure you've finished all your basic training requirements, and I've just listed them there. The important thing would be to make sure that you've met with the DPE at whichever site you're at, so that they confirm that you've met all your requirements. You've done your APLS, and at some point you'll need to do developmental and psychosocial. Some people get to do it in basic training, other people do it in advanced, but you have to do that before you'll get fellowship. And And then the college will send you a letter and you can then apply for advanced training. Now, unlike basic training, you have to apply for advanced training. If you don't apply, you won't be registered as an advanced trainee, and then you'll miss out on time that is very precious to all of you. Okay, so advanced training is 3 years, certified time. Okay, it can be up to much more than 4 years if you're doing dual, depends on the training program. The requirements will depend on whichever specialty you pick. The idea of advanced training is you're building on what you learnt in basic training so that you become a competent paediatrician at the other end. Part of advanced training is also a professional qualities curriculum, which was written many years ago, and at some point the college will rewrite that curriculum with all the other curriculums, but as it stands, it still exists. And if you are a trainee within SCHN, we run the professional qualities curriculum as 6 workshops over the year, and you attend 1 or 2 every year of your advanced training, you'll get to all the workshops. There are lots of programs that you can join, and they go on and on. So a lot of people will do more than one, and there are a lot of people who do general paediatrics and exclusively general paediatrics. So you can do dual training, combining 2, but you have to remember that will mean more time. You can't complete dual training anything less than 4 years. And if one of the training programs has 3 years of core, that means you've got a minimum of 5 years. So just be aware of that before you jump in and decide you're going to do all these dual training. It just extends the time before you can get out there and work independently. You can work independently as a general paediatrician and still be training in another specialty, but it can get challenging to balance that in different jobs. Okay, oops, sorry. Everyone knows about prep. We all love prep, but it's throughout your training. It's part of basic and advanced, and every single specialty has slightly different prep requirements. And so there are handbooks for every single specialty, all available on the website. And I must say the college has made big effort to update the website and make it more user-friendly. I think through a lot of the trainees helping to develop that. And I think if you're finding things are hard to find on that website, you need to feed that back to the college. But the handbooks are there, and I was skimming through it over the last few days, and I actually find it a lot easier to find things now. In addition, there's curriculum for every single training program. They're usually quite broad, although some, you might have to do 10 bronchoscopies, I don't know, there are different versions of what you have to do. And they're also available on the website. So I'm just going to briefly touch on general paediatrics because I think the majority of people will be wanting to hear about what's happened to general paediatrics. So it is a 3-year training program. 22 years of that is core, 12 months is non-core. There are training positions. Now, the way the Advanced Training Committee currently accredits, it accredits sites, not positions. There will be a move in the next few years that we are likely to move to position accreditation, but at the moment it's still site-based. There needs to be supervision, and it is really important that you look on the website for what the accredited sites are so that you don't end up doing training in somewhere that's not accredited for the training you think you're doing. So in that 2 years of core training, the changes from 2017 are that 12 months is in general paediatrics. Now, what that means is you can do general paediatrics in one of the tertiary hospitals, and 6 months of that will count towards that 12 months. But at least 6 months has to include some perinatal medicine. So I'll give you some in Campbelltown, Wollongong, Bankstown, St George, those kind of units where you have neonates delivered and you have to manage them. So at least 6 months of your general paediatrics in advanced training has to include a site that has perinates. The other 6 months you could do anywhere you want. You can do it at North Shore that doesn't have neonates, Nepean, Sydney Children's, Westmead, those kind of places. You have to do 6 months of acute training and 6 months community developmental. And the acute training can be anything from neonates, NICU, PICU, NETs. But you have to remember that sometime in your training you have to do 6 months of neonates, so if you haven't done it in basic training, then you will need to do it in advanced. The rural training has been a real big issue for a lot of trainees. So the ATC wanted some flexibility for trainees, but we truly believed that trainees needed exposure to rural paediatrics because it teaches you a very different perspective on how to manage a child. So we've accepted that if you do it in basic training, you don't have to redo it in advanced, and it will be certified from your basic training. But you would still need to do 12 months of general paediatrics in advanced training, but the rural will be ticked off as not required in advanced. I won't ask if there's any questions, because I'm sure there will be. And then there's 12 months of non-core training, where you can do essentially whatever you want. And what I recommend to trainees is to try to get your core requirements finished in the first 2 years so that you can do what you want in that last year. You can go and do research, overseas work, do a fellowship in a subspecialty, whatever takes your fancy. You need to be supervised. That's part of what is required under any training program. One of your supervisors must have an FRACP, and someone asked me the other day whether an endocrinologist could sign their term reports. For general paediatrics, we just want you to have someone with an FRACP. If you're doing an endocrine term, it needs to be someone you're working with. It's no use you coming to me and saying, can you be my supervisor? I won't be working with you. So one of the important things that's a little bit different to basic training is that you need a term supervisor that you're working with day to day, rather than having a DPE that's going to sign everything off. They can be a co-supervisor if that's what you want for the year. Especially if you're doing 3 month rotations, you might want someone to oversee the year for you. And then you can have a second supervisor who's not an FRACP. And the reason we do that is if you go overseas, you can have someone there who's a supervisor and you get a local FRACP to be your co-supervisor. Sorry. Additionally, if you're working in ED or mental health and places like that, you may have a psychiatrist or someone else who's not an FRACP. You need to have at least one supervisor per rotation, but if you're doing more than a 6 month term, we do recommend you get 2 supervisors, only because it's a longer term. You know, sometimes one's away. We've had situations where a trainee and a supervisor didn't quite click, and then at the end of the term you've got no one else to reflect back to about how you've gone. Okay. These are the prep requirements. So there's, and this is all in the handbook, which is very easy to download. There's the LNAs, minimum of 2 per year, mini CXs, case-based discussions, the supervisor reports, and then the direct observed procedures. You need to do 6 over the 3 years. So if you're doing an acute care term, get them done then, because if in the last year you're doing research, you may not have a chance to get in and go and get someone to watch you put cannulas in, and there's specific ones that you need to do, okay? There's some other requirements, child protection training, there's outpatients, there's a research project, and there's new research guidelines for people who've started from 2017 onwards, and it's really important that you have a look at what they are. And as I said, the neonatal training. It's really important that you understand that training has to be prospective, and make sure that you put in your paperwork by the due dates. And I will show you the policies around some of this in case you have any you know, you want to understand the background to it. The annual applications for trainees, there's two. One's usually in February and the other one's in August. But for you guys who are starting for the second half of the year, it will be the 31st of August. There may be people who have qualified for advanced training the minute they pass the exam. You can apply from that date. So I confirmed that with the ATC. They will, but the issue is there may be a delay, but you should still put an inquiry into the General Peds ATC so they know that you're wanting to apply. All trainees are supervised by a training committee or a society. There's different things for different groups. For General Paediatrics, it's an advanced training committee. They're often made up of fellows and sometimes some external people. For General Paediatrics, because there are a significant number of trainees doing General Paediatrics, to keep up with all the work, the committee meets 10 times a year at least, and then there's often other bits and pieces we do in between times, and that's just to deal with the day-to-day matters that come up with 600 trainees. What the committee does annually is it reviews all the progress reports from supervisors, and then at the end of training, with the assistance of the admin staff, of course, in the college, we make sure that you've completed all the requirements, your logbooks, the research project, your neonates, everything else that's expected for you to be certified to be finished General Paediatrics. Okay, so I'm just going to quickly just mention a few policies. The first one is the Progression Through Training policy, which came into effect in January this year, in which all training must be prospectively approved. If you submit things late, there is a late fee, and they may not accept things after a month, after the date that something was due. You can put in consideration for special circumstances, but there's no guarantee you'll get that, and it has to be exceptional circumstances. And if you don't submit your supervisor reports by the date that the college sets, then that time will not be eligible for certification. Okay, and all these policies are on the college website, but also in the handbook there's links to all these college policies. The flexible training policy has also come into effect. Essentially, just the nuts and bolts. Minimum training is 0.4 FTE. So if you decide to reduce your FTE, you need to work at least 2 days a week, and that's mainly so that you have some clinical exposure, and this was debated quite hotly in the college about what minimum time people could get certified. And just so that everyone's clear, you can have up to 8 weeks of leave without it affecting your training time. But if you do a 3-month term and you take 8 months of leave, they may not certify that whole time, because that's quite a lot of leave if you're doing a very short period. They've also now set out exactly how long they would expect you to complete your training program. So for a 3-year training program, you've got up to 8 years, 4 years, 4-year program, 10 years, and 5-year, 12 years. That does not include parental leave, which you can take another 2 years for. You can interrupt as many times as you want, as long as you don't exceed the length of time that that program should be completed. If you return after 12 months continuous interruption, you may be asked to do additional formative assessments. If you take 2 years, you may be asked to do a little extra training, just because of concerns that you haven't had exposure to things for a period. It would be unusual. And then if you take excess leave, as I said, they may not certify that whole time, and that's all within the policy that you can read about. Part-time trainees, please be aware that you still have to do the full prep requirements. So that means that if General Peds says you have to do 4 mini CXs, you have to do 4 mini CXs even if you're 0.4, okay? Because lots of people have been caught out by this. And the minimum time that you can request for training is 1 month. Okay, so if you decide you're coming back and just do 3 weeks, you won't get that time certified. There is the trainee support unit, and they have been very good for trainees to help us keep them, keep them working, and to provide the support that they need to make sure that they can continue their training. Most sites will have local processes first, and would only, the college asks the local sites to try to provide as much support in the initial phase before trainees are referred to the training and difficulty pathway. It shouldn't be seen as a negative thing. It is actually a very supportive unit to try to help people to get through their training. Remember, there's lots of training opportunities, and I won't ask that one. And that's it. That's all I got.
Excellent. So thanks a lot, Hala. So next we welcome Professor Nick Woods. So Professor Wood is a general paediatrician at the Children's Hospital at Westmead. He's the Sub-Dean for Postgraduate Research at the University of Sydney and is a Senior Researcher at the National Centre for Immunisation Research and Surveillance. He's also a member of the RACP Paediatric Research Committee and frequently supervises paediatric trainees in research and in college projects. So welcome to Professor Wood.
I'm also Nick, so not. So this, firstly, echo Hala's congratulations to you all. It's fantastic to get over that hurdle, and now the fun begins. Can I just ask, has anyone started a project yet? No? Okay, that's good. That's excellent, because you've only just passed the exams. We weren't expecting you to. Okay, so I'm going to just give you some thoughts about types of research, how to do it, and where to go to, okay? Another thing to say is the college has done fantastically with the new guidelines for the project. So encourage you to really go there and have a look at that on the web. Okay, that's really your first port of call. Print it off or use the iPad and have a read in bedtime to read that document, because it really is give you everything you need to start with. And I think the college should be congratulated for doing that. The other thing to think about at the beginning is, do I need to do a project? Okay, so maybe you could flick straight to the page that has exemptions for the project and see whether you meet these things. And that's if you've done a MD or PhD, a Master's by Research, or if you've done a Master's by coursework and have already done a major project, okay? So just think about that one before you dive into it, but you can still do a project if you want to. So now the college has specified 3 types, and that used to be a problem for trainees. Oh, does my review of 100 patients count, and we used to be able to get away with, well, we not get away, we had to do 3 projects, and one of the projects could be an ethics submission. So I think they've tightened it up a lot more, okay? And so now it comes down to 3 fields. The second 2 are sort of a little bit more easy to understand. It's a systematic review, an audit, and then the top one is sort of a grab bag, and that's research in human subjects, populations, laboratory research, epidemiology, field research, or medical education. So it is very broad. Okay, so you guys have to sort of think, which of these 3 am I interested in? Right? I nicked the bottom bit from the Royal, dare I say it, from the Royal Children's Hospital in Melbourne. They've got an advanced trainee page, and there's a couple of useful documents there. Not to say Sydney Children's Hospital Network is not doing a good job, but they do have a couple of useful things there. One is that they say that it's about 200 hours work over 2 years. If you're really, really organised and you set aside the hours of 4 till 6 p.m. every Friday, that will probably knock it off. But the other thing to say is make sure you plan and start early. Okay, well, sometimes as a supervisor I've done probably nearly 10 advanced trainee, and people are varying. Some people will throw the project in front of you on the 30th of August and say, look, I've got to submit it by tomorrow, can you just have a quick skim? Having said over the last few months, what's your deadline, when do you want to submit? You've got to work towards this, whereas others are different, they've given it to you early on. So have a look at the timelines and we'll talk a little bit about that. Ideally what you want to do is have it passed at least 6 months before you get your letters. Okay. What you don't want to do is have qualified for your letters and then have this project hanging over your head. And unfortunately, some trainees get stuck in that position because they passed time-wise and all the other prep bits, but they haven't got their college project, and then they can't take up a locum job or a VMO job or a staff specialist job. Okay, so there's that where it gets to the end product, and it's worth making sure you're not in that situation. I'll talk a little bit about finding the right supervisor. Okay, so there's the link to the e-learning portal, and these are the sorts of things it has on it. It has very detailed about how you even structure your advanced trainee project, from the abstract to the introduction to the aims to the methods, etc. So if you follow this, you'll do really well, because you know what? The examiners tick 1, tick 2, tick 3, and they rank them to see whether you've done this. So they look at those things: introduction, below standard, meets your standard, exceeds. Okay, and that I thought I'd get into trouble for showing you the marking sheets, but they're on the website. So you can. My advice is make sure you, when you finally get to put it together, make sure you followed that structure, because when the examiner's sitting there on a Saturday night with a glass of red wine reading your report, he's got that marking criteria out and he's looking abstract. Which of these boxes should I tick? Okay, and if you've presented it all nicely, it's really easy for them to tick the right hand into the boxes. Okay, so definitely do that. Okay, at the start of the project, you might feel a bit like this, confused, lost. Which of these topics should I go for? Okay, you've got to think of the right supervisor, the right project, and the right plan that can get you to the end. Okay, so in terms of finding the right supervisor, I think the thing to think of, and we often show this to our higher degree students, those doing masters and PhDs, is that your world is on the right, left here, your left. The supervisors is on the other side. Okay, so when you think your project is the most important thing in the world, which it is to you guys, supervisors probably got other things they're doing, so you just have to make sure you plan, but at the same time, probably think about whether the supervisor is the right person for you. If they're extremely busy, have they got the time? Are they about to go on sabbatical or about to move to another institution? These are the sorts of questions you have at the beginning with them. Okay. So that's just one of the things. And one of the things we find, certainly with the higher degree students, is that there are mismatch of expectations. So it's really important at the outset to sit down with that supervisor and say, okay, here's my project. Well, this is the project we're going to work up. What do you expect from me? And what do I expect from you? Now, that might be a bit daunting, going to the professor of endocrinology and saying, I expect you to be here on a Monday, every Monday, and sit for me for an hour and go over my project. But if you can at least come up with some sort of plan about how you might do it, it may be, okay, I'll meet you once a month and this is what we're going to talk about. That's really useful. Okay, it saves you at the end having a big rush. We tell this to, as I say, to higher degree students, and they'll go, yeah, I'll do that. But one of the troubles we find when we down the track, when it's not working so well, is they haven't done it at the outset. So it may be a bit daunting, but ask the supervisor, have you done a project before? How did it go? Did you get the student through? Have you got the time to supervise me? And hopefully they'll be honest with you and say, yes, I can do it, but this 3-month period, I'm actually going off on sabbatical, so you really won't get much from me from that time, but that's okay, it fits in the timeline. So don't be daunted about asking them. It's better to come up and say, look, this is what I want to do. I want to get it done in the next 12 months. Here's my plan. I'm going to put in the ethics in these 2 months. I'm going to collect the data these 2 months. I'm going to do the analysis this month, write up these 2 months, submit it to you, and I'm going to not submit it to you in January when you're writing NIH and MRC grants, because I know I'm not going to get anything back from you. So that you have to just think about it. And as I say, don't be daunted asking them, because they appreciate that from this side of the fence, that you've thought about it, that you're proactive in planning, okay? And ask them what they expect from you as well. The supervisor ideally will be these sorts of things. Can obviously mentor you, be a bit of a guide, assist you through any obstacles, be a referee for you, and add value to your research, okay? And I think the other important thing that they'll do is they will be someone that you can create opportunities for you. So you can be a little bit strategic about choosing your supervisor and your project. If you say, I really want to end up doing neonatology, okay, it's better if you can choose a neonatal project, because you get into the subspecialty, okay? If you want to do endocrine, do an endocrine project, because you're interested in it. One, it'll be interesting to you, but two, it may create opportunities. And a good supervisor will say, okay, we're going to enable your particular work to be put in an abstract for this conference, or this workshop, and you can ask them about that sort of thing. They'll introduce you to specialist groups, networks, and it may well be that there'll be an ongoing relationship afterwards, particularly if you want to do that particular subspecialty. So you can be strategic about it, and I'd certainly encourage you to do that. It may well be that the supervisor, which I'll finish off at the end, will encourage you to do a higher degree as well. But you don't need to go there just yet, but certainly do be strategic about it, okay? There's no prizes for, so I'm going to do neonatology, but I'm going to do something in adolescence. Doesn't quite match, because when you go for a job as a neonatologist, you can say, well, my advanced trainee project was in the use of surfactant or something. It just makes it more useful to you. Okay, that's definitely worth doing. Okay, so these are the three types: the research in human subjects, the audit, the systematic review. Have any of you thought what you might want to do? But they're very different, okay? So systematic reviews is obviously literature-based. Audits can be a bit of a mixture of clinical data as well as literature, and then human subjects, populations, labs are when you're getting down and doing, obviously hands-on stuff. You can do it as part of a bigger team, so you can be in, say, the endocrine department, and they've got a big project grant happening. You might just take one section of that. That's allowable and certainly useful. Useful for you because the system is already set up, but also useful for the granting people because they know that that part of it is under someone's control and someone's actually doing it. Okay, so it makes sense. So I'm looking at Lucy. We've got a grant on febrile seizures. I'm hoping that Lucy will take part of that because it makes life easier for me. Not that she needs it for the trainee project, but it's, you know what I mean, it's a setup, the vehicle's running and what you're doing is fiddling with the radio while the other person's driving it, okay? So have a look at previous successful projects. Talk to the supervisors in your hospital. If you're not sure whether they're the right one, go and seek a second opinion, okay? They say the project is around about 3,500 to 5,000 words in length, okay? When you think of the project, you obviously got to think of ethics. So this is all spelled out on the e-learning. there's a really good portal there, which I showed you the link at the beginning. You basically step through it. There's modules to follow, and I must say, I had a look at it, it's actually really good, and it's really good exercise in research training as well. We might nick it for the higher degree students that we have. So I really encourage you to do it. So think about the ethics. What statistics will I do? Okay. What support's available for me to do the statistics? How will I keep the data? Okay, the data stewardship or data is getting much more controlled than used to be. Just had on your Excel, which you carried around on your USB stick. Doesn't work like that anymore. It's got to be on electronic databases that are secure and stored appropriately. Do think about how you're going to do that, and there are people that can help you do that. Okay, a few notes on human research. Obviously it involves humans, so patients. The thing I would say about that is that it can take a long time. Okay, so if that's where you want to get skills in, I want to learn how to do an intervention study, or I want to learn where I randomise so-and-so to drug A versus drug B. If that's what I want to do, just be aware that it can take longer than you think. Okay, even if you want to recruit 10 people, it'll probably take twice the time you think to recruit 10 people. All right? They can be prone to delays getting things through ethics, and there's obviously a cost. Okay, so you just have to think about that. That's the area I work in because I find it interesting, but it is a bit more, I suppose, tricky, and it's a little bit out of your control than, say, a systematic review where you're pulling stuff out of the, Medline and databases like that, where you're not really at the behest of other people. You don't have to recruit to Medline. Okay, so that's the thing. If you want something that's really under your control that you can do from your home and on a set time, systematic reviews or audits might be more suited to you. Obviously, it's less cost because it's just you and the computer. But for the ethics of the human research, it's less in your control. Okay, and they are very different. But again, we encourage you to be strategic about where you want to end up. Okay. Are you on track? There are lots and lots of tools to help you keep on track, okay? It can be very difficult, but there are lots of tools out there, and then some of them are in the e-learning portal. There are little Gantt charts. Some students will actually, the really organised ones, will have it done by week, over that sort of period of what they're going to do. Again, it's a useful thing to do, but you don't want to spend 6 months designing a Gantt chart when you could be doing the work itself. Make sure you try and get your work published, okay? Really important. Even if it's when you do your ethics submission, you have to write a protocol normally, okay? If it's a human research. When you write the protocol, you often have the first part of the protocol is the background. And it may well be, if you're in your area, I don't know, the use of, let's think of something, folic acid in maple syrup urine disease, you might want to, if you do the research on that and you put that into the ethics, that background could be a published publication, okay? So think about how you're going to use it just to slice up little bits of it. So that certainly is useful. You can ask your supervisor about the journals, which are the clinical, which are the basic sciences. Think obviously you want to get things in the higher impact ones, so have a think about that. But again, you can do the research yourself, talk to the supervisor and say, I've got these 2 or 3 options I'm thinking of, which one do you think is a good one to go for, okay? Have a look and see what other papers have been published in your journal. So try and get things published along the way, and certainly I think in an ideal world, all college projects will be published and all college projects should be presented somewhere, okay, at a conference. Decide on the other thing we run into trouble is if you're going to do a paper, make sure you work out what the authorship is. It stops you having a punch up in the corridor later on when people say, you said I was going to be first author. I never promised you first author, blah, blah, blah. So do it at the outset, okay? Try to enjoy writing, okay? If you can, write it, go away, then come back, there are writing courses, and the e-learning portal has things there. If you get reviewers' comments back, don't take them personally when they say this is badly written, etc. Don't think of it as a criticism. And there's some other tips there. So I think I'd encourage you to go out and do a writing course, because it is it's very useful for lots of things. And then finally, here's the pitch, or here's the sell. Some advanced trainees decide to enrol in a Masters of Philosophy at the same time. So you can do that, and probably the best thing to do if you're going to do that is part-time enrolment. All right, so that will take you at least 2 years to do it, the MPhil, and it is a bit bigger than the Masters, than the trainee project. Okay, so it is extra work, but possibly not too much extra work, but certainly is extra work. The benefits are that because you're now enrolled in a higher degree in the university, you can get access in the university supports. Okay, now the other thing to say is, if you can, try and get an affiliation with the university, the New South Wales or Sydney Uni, if you're in this area, because then you can you get a uni key, etc., access the library, access statistics supports, and possibly even access some of their learning things. So in addition to the college stuff, you've also got the university. And that's really useful, particularly the library, for systematic reviews, okay, because they can help you design it and even run things for you, okay. If you do an MPhil, you obviously get an academic credential in addition to your letters, okay. And obviously, what the final pitch is, you can, if you've done well and doing well in the MPhil, and you can upgrade to a higher degree later on. So that was it from me.
Thanks, Nick. So, just like to welcome our last speaker, Dr. Nogajski.
That's it. Come on.
Okay, you can introduce yourself.
No, it's fine. You don't need any special words from me. All right, everyone. So, as Phoebe was going to say, she's going to do something very long about me, but basically I'm Beck. I'm a PhD physician at Westmead Children's. You're not videoing this in any way. Thank you. Sorry. I'm a Peds Emergency Doctor at Children's Hospital Westmead, and I'm also the Director of Advanced Training out there, and I've recently taken on a new role as the Deputy Director of Medical Administration. So I'm really tired. But anyway, so what we're going to talk about today is advanced training reflections and observations. Now, I normally say it wasn't that long ago that I was an advanced trainee, but then I realised actually it was that long ago that I was an advanced trainee. It was probably about 10 years ago now. I am trying to hang on to my youth, but I'm going to let it go. But I now see a lot of trainees coming through, and there is common themes to you guys. And we're not all the same, we're all different. I understand that, but there are some common themes to advanced training that I think we should talk about. All right, so this is you guys. You've just passed the exam. You're like, yes, I've got my life back. I'm going to go to the beach. I'm going to go out and see my friends. I'm going to go to every wedding I possibly can that I've missed out on because I've been studying for so long. But you can do that, don't worry. We're all about work-life balance here. But the college project. We need to talk about the college project. Nick, I loved your talk. I loved it. And I hope people at Westmead are listening, and I'm not pointing out to Naren in particular, but you have to. Sorry, Naren. You have to start early, okay? You cannot role model me. I was that trainee. I was the trainee in the last year of my training as the emergency fellow, and I thought my Masters of Medical Education counted as my college project, and they probably told me it didn't, but I ignored it thinking, oh yeah, I can still have it as my college project. And then at the last minute, I was trying to do my college project. In the last year of my training, where I should have been forward thinking, where am I going, networking. And I'd just gone for an interview for a consultant position at Sydney Children's Hospital. And then I get my result for my college project, which was a fail. And I had 6 months to go. Now, I was very lucky This does not happen very often. I was lucky and I managed to get my project as a pass. But it was a learning for me that you do not leave your project to the last year. It will hold you back. Your last year of training should not be about doing your college project. I'm obviously very passionate about this, but you have to start early. You want to get it out of the way. And as Nick said, this is a networking opportunity for you guys. You should be doing your project with where you want to be. You know, your supervisor will be a person who will then give you a network, give you other connections, and you are known to that department. It's really, really important to be strategic about your project, okay? Do not leave it to the last year of training, please. Right, so the next point is ownership. I'm going to sound a bit mothery, and I'm allowed to. I have 3 small children. I don't want you to come and see me and not know what your training requirements are. Okay, you're all nodding at me, but you still do it. So Hala has stepped through the training requirements. Okay, you need to own your training. This is your training. You need to know when college forms are due in. You need to know what the requirements are and use these requirements as your professional development. A mini CEX, a case-based discussion, should be useful feedback tools for you guys. And if they're not, you need to make them that way. You need to own that process, okay? So if your supervisor isn't stepping up to the mark with how they're doing case-based discussions, you know, you need to change that. So you need to go, actually, this is what I want to get out of this. I actually want to concentrate on my communication skills or my conflict resolution skills or my clinical reasoning and actually own the process. Right, this is really, really important. This is important for you guys to realise that you're in charge of your training and your continuing professional development. And this is what you're going to have to do as consultants. So it's really good to start now. And you're role modelling to all the juniors that are under you, because what you do now, that's what the medical students are seeing. That's what your intern is seeing if you go off into adult land. It's what your resident is seeing. It's what your junior registrar is seeing. Okay? You are now in the realm of leadership. You need to role model good behaviour, and this is great behaviour to role model. So we need to start looking towards the future, because you sort of need to know where you're going. If you want to be a general paediatrician in a metro area, well then you've got to go, how am I going to get there? What do they need? Where do I want to work? I need to get rotations there. Or do they do a lot of deliveries? Okay, actually I think I might need to go and do a bit more neonates, because 6 months of neonates in your general paediatric training, you know, may not cut it for you guys. So think about where you want to be. Think about how you want to work. Do you want to be a staff specialist, or do you want to be a VMO? Do you actually want to, you know, do rooms, or do you actually want to be attached to a hospital where you get the opportunity to do teaching and research and supervision and all these other things as part of your job, as part of your contract job? Because you'll still do a bit of that as a VMO, but really think about it, okay? But that said, you have to be open to change, because things do change. Situations change. You might actually change your mind, or life happens and you go, actually, I don't want to do that anymore. So I think you need to have direction, but always remember a little bit of flexibility goes a long way. All right, so experience. Again, I want you to think about, who is your favourite consultant that you've ever worked with? All right, I'm not going to ask you, Phoebe. Why were they your favourite consultant? And now I really want you to think harder. What exactly was it that made them your favourite consultant? And how are you going to be like them? Okay, so have you all got that consultant in your mind? Hopefully there's one. Or, on the other hand, you could go, who's your least favourite consultant? All right, everyone goes, oh yeah, I got one of those. They go, you did, that was much easier for you, unfortunately. And then you think, why were they your least favourite consultant? What was it about them that made them your least favourite consultant? And how are you going to be not like them? Okay? So it's all about one step at a time. So it's really easy for me to go, this is where you're going to be like. I want you to put someone up on a pedestal and go, I want to be like them. But what actually does that mean? And what does that look like? And how are you going to get there? So you might go, yes, I want to be like Nick Wood, and he's amazing. His research is amazing. He's doing all this stuff. He's supervising everything. That's amazing. But how do you actually get there? And how do you know you're going in the right direction? All right? So if you start setting goals for yourself, which I think is really, really important, you have to make sure they're smart goals, you know, they're achievable goals, and you know you're going in the right direction. So who's going to do that for you? What checking in mechanisms have you got for yourself to go, actually, I like consultant X because the way they communicate with patients is just amazing. And I want to be like them. So what bit of that are you going to try and get to? And how are you going to get there? And how do you know that you're actually reaching that point? So what's your assessment going to be? Okay? I want you to really think about that in your training because, like it or not, and I keep coming back to it, you guys are role models. The hidden curriculum in medicine is very much alive and well. So the bad behaviours that we do, the below-the-line behaviours that we do, you know, when you come to emergency or I ring the cardiology registrar and I come down and see your patient and they go, I'm really busy on the ward, and I hang up and I go, oh, you know, cardiology. They just never answer their page on time. And yeah, okay, I'll see them in about 3 hours because that's what they always do. I don't know what they do up there. That's what you're going to role model of me. Okay? But if I went, oh, cardiology, excellent, they answer their page, they're super busy. When they come down, let's make sure everything is really good for them because they work really hard in the wards and they're here to help us out. Okay? Totally different. So remember, your behaviours are what you are role modelling to people, and it's what you pick up. And this is what I am passionate about. So anyone that comes to the professional quality curriculum often has me up the front like this, slightly manic, slightly tired, and talking about all these skills. In 3 years' time, you are going to be expected that you can do these things. Okay? So when I was a fellow, I had to supervise junior trainees. I had no training in supervision skills at all. And I did it of how I was supervised. So what I did was I went, okay, I liked how my supervisors supervised me, you know, 3 of my supervisors, and that's what I'm going to role model. But remember, how we get supervised is often in a room, behind a closed door. You know, you don't often see other ways of supervision. So do you actually need to have formal training in these skills? And I would argue yes. And I know a lot of our consultants haven't had formal training in these skills, so we're just sort of doing our best. But is that the right thing that we should do? So in your advanced training, think about all the other things that you are going to be doing as a consultant, and actually you're doing them now. And you shouldn't wait to consultancy to pick up on these skills. So supervision, there's the supervision support, supervision development programs through, I should know the name of this because I am a facilitator, through the college. You can do them online or face-to-face. And trainees come to these things, and they are excellent. There are 3 of them. You should do them in your advanced training at some point. Coaching, really important to get involved in, and this is something we don't do in medicine, but there are actual coaching programs around, also through the college. Mentorship is really, really important. Everything is important, but mentorship is important. And I know across the network we've got mentorship programs which are starting out and up and running, but think about for you, who are your mentors? Who are you going to go to have a chat or to have a debrief or to help you in terms of your pathway of where you're going to go? A lot of the time they end up, for me, being my old supervisors. So if your supervisor can't really be your mentor because they're sort of assessing you, so it's a bit tricky. But once they've finished supervising you, I often went back to my favourite supervisors and they've become my mentors. And I've been really lucky. I've had fantastic mentors through my training, and I go back to them now and I go, this has happened. It's not necessarily about clinical stuff, but it's like, I had this really difficult conversation. Or I had this run-in with cardiology again. Or I had this run-in with surgery, you know. So these are the things you've actually got to be aware of and mindful of and go, how am I going to develop these things? And communication and teaching. Now we all teach, we do it every day. We teach medical students, JMOs, nursing staff. We teach parents every day. Okay, that's what we do, we educate. So we should make sure our education skills are the best that they can possibly be. And this is the perfect time to really start harnessing these skills. Oh, and this is the other thing that happens in advanced training, life. Ha, hilarious. So for me last year, I mean, not when I was advanced training, obviously, but last year, my dad got diagnosed with renal carcinoma because he was being over-investigated for his prostate cancer. I mean, God, it was hilarious. As soon as I had a CT scan, there was a renal carcinoma. But all of a sudden, I'm like, oh my goodness, I've got 3 small children, I'm working, I'm busy, my husband works full-time, and I've got to go to Hobart and, you know, be there for his kidney to come out because, you know, I just want to make sure things go right. You know, my brothers are hopeless. Well, they're lovely, but they're hopeless. You know, so, but that happened to me, you know, only last year. And I was lucky enough that, you know, I'm a consultant and it's easy for me. I think the perception is it's easy for me to go, I'm taking leave now and I'm going. This is what I'm doing. So life happens. In terms of my friends throughout their advanced training, marriages all the time happen. And now my friends are getting divorced. You know, we're at that stage. People are having children. People can't have children, or people have recurrent miscarriages. It's a really stressful time for both male and female trainees. Parents are getting older. Parents get sick, you know, and we ourselves get diagnosed with illnesses because we're not as young as what we used to be. You know, a couple of my good friends, one, you know, has been unwell. The other one got diagnosed with MS. Really, really, these things happen while we're working. So life is stressful outside of work. And we have to remember that, you know, JMO, well, every doctor's wellness and mental health is very prominent at the moment. You know, you can't turn on Twitter or turn on the news, or even Domain today had an article about how doctors are buying closer to the hospital so they don't have a long travel time. And that's on the Domain page, which I thought, wow, it's even reaching there. But our job is stressful. We deal with people who are sick and unwell. You know, life and death matters. That's what we do. It's a really stressful job. So you've got to remember, actually, life happens as well. And how can you be the best person you can be? So when you turn up to work, you are in the right headspace. So you need to know yourself. You need to know the signs of burnout, compassion fatigue, and also mental health. So they're different things. But, you know, anxiety and depression, we're normal. There's a population risk, and we are slightly more at risk than others. So we have to know ourselves, we have to look out for our colleagues, and we have to be kind. Okay, so this is really important. It's a really stressful time, advanced training. You think the exam's really stressful, then it just keeps on going. It does, it is. I think it's quite stressful. But that said, if you are feeling that things are too hard, or, you know, you're not on top of things, you've got to put your hand up and ask for help and look after your colleagues. This is really important. Okay?
This question is really for Hala and Lydia. So I saw in your presentation, Hala, that it said community/development. Is it? There's a lot of confusion about if community is separate from developmental training and what counts towards community as opposed to development and psychosocial training.
So the way the ATC works, there are a list of things that would be signed off as community/developmental, and that list is available in the handbook. Palliative care has been added to that list. You can do a developmental term, you can do a community term, you can do child protection. You can do psychiatry. So there's a whole bunch of things that are listed there, and the idea is along the lines of what Beck was saying. Plan your training. If you feel like you need to do developmental because that's a deficiency, then try to get that term. One of the things that has come into the logbook is that you will need to do 30 new patients that have a developmental slant to them, and that needs to be signed off as part of your advanced training logbook as well. So you can get all those things signed off. What you need to be aware of is, so the thing that confuses people is the developmental psychosocial versus community developmental. But anything, the college has agreed, and we've had this signed off at all levels of different committees, for general PEDS trainees, if you do a community developmental term, it will be signed off for developmental psychosocial. Those two are relatively interchangeable for advanced training under general PEDS. But if you did developmental psychosocial in basic training, you still need to do your community developmental in advanced. Does that make sense? Or is that very confusing? So you have to do community developmental in advanced, And if you've done it in basic, you will need to do 6 months in advance, regardless of what you did in basic training.
I've got 3 months of basic training still to go. Are you able to start the research project in basic training but complete it in advanced training? Does anyone know?
So ideally, the project is something you do in advanced training, but I think 3 months is not going to be a decider. The concern that the college has is if you do it before you enter training,
yep,
or if you do it at the start of basic training and then, you know, I mean, the idea is that you get research experience, but it is an advanced training, part of your advanced training. And sorry, there's something I just wanted to mention about the progression through training and interruption of training. So if you're a basic trainee and you've got no more training requirements this year, but you decide not to join as an advanced trainee, you still have to apply for a continuation of training, okay? And you need to put that application in, otherwise there's a gap in your training record, which is not.
Another quick question, sorry. So I might be on my own here, but let's say...
He's our youngest exam candidate.
Your baby starts crying. Let's say you have really no clue about where you're going with your research project, and like I think a lot of us might be, or whether you're in Gen Peds or potentially wanting subspecialty but not aware of it yet.
Yeah.
And I know you said like find a supervisor.
So easier said than done.
Yeah, exactly. Like I'm sure all the paediatricians here have multitude of followers. So do you approach just like somebody that you're familiar with and say, who should I approach? Or do you try and research what you want to research on? Or just as a starting framework?
So good question. I meant to say it, but I'm not sure who the person at Randwick is, but Sue Wolfenden is it? So and Patrina Caldwell is out at Westmead. I know for a fact that Patrina has a list of about 40 or 50 projects that you could almost like you could scan them and say, oh, that looks interesting, or I'm not doing that. And attached to that is a supervisor. So Sue may well have a similar list. And I did ask Patrina if it was up on the web somewhere, and she says it's not yet. The thing with that is they do change a bit. So hopefully tomorrow or Monday you'll all go rushing in and say, where's your project list, before someone else takes it. But that's a good way to start, just to scan the dossier of projects, and then you might think, well, none of these are really what I want to do. I'm sort of interested in community, and maybe Patrina or Sue will have some ideas, or Beck or Hala might as well. I'm happy to try and help if you've got a topic as well. Does that make sense? Yeah.
I think, Sasha, the important thing is make sure you're doing something you're interested in, because if you pick something just randomly and you've got no interest in it, what I've found is people don't see it through and they fall down, and then people get frustrated. So you really need to find something that you want to do, because if you just pick something just so that I can say I'm doing my project, you'll find you'll get to the end and you don't get to the end.
It's about the project again. At which point do you have to commit to the college what the submission date will be?
And these guys might answer that better than me. I know there are deadlines.
So there used to be 2 deadlines for general paediatrics. They've put a 3rd one in, and we've added lots of confusion to people this year by adding a 3rd one. We thought we'd help people, but it's caused a little bit of more confusion. So there are 3 deadlines. You need to submit them by that date for it to be considered by the committee for that date. The reason we added a 3rd one was so that there is more accessibility for people to submit them, so people aren't panicking and saying it used to be March and August or October? August. We've added one in June just to spread it out for people through the year, because there was a big gap between the 2. The
college doesn't have to know that you're doing a project just on the submission?
So a while ago we got rid of send in an abstract, because what we found was people were submitting an abstract and then it had nothing to do with the project they ended up doing, and they assumed that the abstract meant that it was a good project, and it doesn't always equate. And I think the better thing is just to have a supervisor who is confident in projects. Usually someone who's done a college project before is better, but even someone who will look at the guidelines with you and make sure that you meet the guidelines. I think the way people have fallen down in the past is they haven't, I find it very hard to believe some of the ones that we've seen in the past have even gone past the supervisor more than the day before, and it's quickly gone in because they just don't meet any sort of standard. Yep.
Yeah. So just talking about projects, I mean, I think you're right. I think it's very hard to find the right supervisor, but it's really important to get something that you really love, because you will be going to bed with that project for probably a whole year, and it's really important you like it. The other thing that I want to say when you're actually just writing it up is that the quality of the writing is quite appalling, really. So I really want you to just read over it, make sure there aren't typos, make sure that the grammar's right. Even just things like the references at the end, they have to be consistent. There's not very much consistency in the referencing. So just make sure that just those simple things that you would have, you know, when you were doing your HSC, you would have been very conscious of that. But suddenly when people are writing their projects after all their training, they've suddenly forgotten just basic grammar. So that's a very simple thing. Am I being harsh? I mean... It's one of the criteria. Yeah. So notwithstanding... Yes, that's right. Notwithstanding the interest that I want you to be able to have in the actual subject matter, just those basic things are very important because you are actually marked on them.
Hi, thank you. Just a quick question. Are there any requirements for who the supervisor is for your project? Do they need to have
requirements for the supervisor? Who's the supervisor? Do they
like,
need to have an RACP?
Yeah, do they?
For the research?
Yeah, for your research. No.
Someone who can supervise.
So I wanted to ask a question, but I also just had a comment. Beck mentioned the PQCs before, and I recently attended the research one, which was awesome. And if you're struggling as to what to do for your college project, Katrina will talk you through how to do a systemic review, and it's a really, really, really good day, and you leave inspired, thinking you're going to be like writing a Cochrane review by the end of the week, and then that quickly diminishes. But I would definitely recommend anyone who's lost with their project to go to the PQC because it was awesome. Yep. And I do have a question. For people doing dual training, what are the requirements in terms of case-based discussions, CXs, and when you're doing your term supervisor's report, do you have to fill in two term supervisor's report for each of your terms? So do you have to do, say, a community one and a general paediatric one because it's slightly different?
Shall I answer this? So if you're doing dual training, depending on what you're doing at the time, you only have to do one supervisor, like end of term supervisor report. The only thing that we have sort of introduced recently is that if you are in a placement for more than 6 months, then it's good to have 2 supervisors. Normally just one person is signing it, but then you can have a second co-supervising it. But if you're doing, say, general paediatrics and community, for example, you will get the person working with you writing that supervisor's report. You're not going to have then another general paediatrician writing that report. It will be the person that you've been working with for those 6 months.
But, yeah. General Peds is a very generous advanced training committee. We don't mind what form you provide, but the other specialties do. So people who've done endocrine training have come to me with an endocrine form and said they need to have an endocrinology. No, that's fine. That's not an issue. I mean, the endocrine committee, I think, or advanced, say, any other subspecialty, if it's non-core, it may not be such an issue. It's only if you want core training signed off. In regards to the prep requirements, you have to do the prep requirements of both committees if it's going to be counted by both committees. So if one committee says you have to do 4 case-based discussions and the other one says 2, you have to do the 4 or you won't get it signed off by the other. Yeah. No, you don't have to do 6. You just have to do whatever the most, yeah.
You can do 6.
We seem to have lost Westmead, have we?
Yeah, I think they've dropped out or something.
But as a dual trainee, I would say be really careful about what you're doing and do the maximum requirements for both. It's not hard to get your supervisors to fill in 2 similar forms at the same time. It's hard to, you know, a year later find that term wasn't accredited and then try and talk to the SAC about how you can accredit that term, try and get your supervisor to remember you, etc., etc. So just be really, really careful about those kind of things.
There's also someone on the college under member services for all of the general PED subspecialty training that you can ask those specific questions if you're not sure. So then when you do your kind of term supervisor reports, you're doing the right one. You know, if you've gone through all the manuals and everything, you still can't quite work out or not absolutely sure, there's always someone in the college that you can email and double check.
And I would add to that as well that if you find that person in the college doesn't give you the answers that you need, you can always ask for advice from the SAC as well. Yeah.
Sorry?
So they're always someone that you can always contact someone for advice about if this training will count, what do I need to do, why hasn't it counted?
So every advanced training committee has an admin support. Yeah, no, that's right. Have admin support, but in addition, most of them have a trainee rep, and you can ask the trainee rep to find out for you as well if you're having trouble. So for general paediatrics, there's a trainee rep who sits on the committee and is available for any inquiries. And every committee meeting, we ask the advanced trainee, what are the trainees wanting to know? And she says, no one asked me anything. It's great.
Okay.
Do you guys have any questions?
Yeah, what you're saying.
Questions, guys? Thank you.
I just have one for Beck. So I know mentoring is really important. How do you ask someone to be your mentor and know that the person actually wants to be your mentor and isn't just being nice? I know everyone's probably thinking about the same thing.
Yeah, you want a rose, don't you? You don't want to be rejected.
I don't want to have kind of meaningless conversations with somebody who's just trying to be nice.
Yeah, so I think this is tricky, and I don't think there's a set pro forma or a little spiel that you can write down and do it. I think a lot of the time you get, I hate this, but you get a vibe. You get a vibe that person like actually wants to chat and you like what they say and they're receptive to you. That said, in the last couple of months, I've been asked to be someone's mentor, and the way they've gone about it, one was actually a junior consultant who came up to me and said, Beck, I was wondering, would you be my mentor? And then she followed it up with, but I wouldn't ask you very much and I wouldn't take up very much of your time, so is that okay? And I'm like, yeah, of course, that's fine. And the other person, there was an incident in emergency and she was coming off night shift and I was on a non-clinical, and I said to her, because she was obviously quite shaken by what had happened, and I said, I do want to go and get a coffee and debrief about it. And then after the debrief, I went, you know, we should touch base again in a couple of weeks. And then after that, she sort of said, do you want to have coffee again in a month? I'd like to discuss stuff around training. And I went, yeah, okay. And then I've just assumed that I'm her mentor. I haven't actually formally said that. And I'm just picking up mentees as I go. But, you know, she buys me coffee, so that's a good thing. And big picture people. But I think that it has to be a two-way street, and I think a lot of the mentors I have, I just continued that relationship. Like I would just either email them and formally set up a time to say, can we, I was wondering, can we have a chat about X, Y, and Z, and make it a bit more formal, so then they know that's a formal mentor time and you've actually got time to discuss stuff, as opposed to taking it on the end of a conversation or running into them in the corridor. You sort of really want to formalise that. And I don't think there's anything wrong in formally asking to be can you be my mentor? And it's like asking for references. It's awkward the first time you do it and say, will you give me a good reference? Everyone hates doing that, but you have to do it. And I think the more times you ask, the easier it becomes. Does that answer you? Who am I looking at? You. Does that answer your question?
Asking on behalf of the trainees.
And people should actually say that backwards. Actually go. You'll soon know. They'll go, I don't have time, or they'll go yes, and then that relationship sort of just continues on. But it's a really important thing to have mentors. It is really.
So start asking.
Excellent time.
Any other questions?
No, excellent. So if there's no other questions... Beck's got
the next, not a question, but the next PQC, right? I know you guys, that was the question you wanted to ask, yes. It's on Friday the 28th of July here at Sydney Children's in Conference Room 6, and I'll make sure the flyer goes out again. And our ESO Moira Morrison, she does all the registrations. It's full day, ask for study leave, talk to supervisors and your heads of departments ahead of time. It's catered and it's really useful, and it's on leadership and management, and we have some great people speaking. So that was the question that they wanted to ask, and now Phoebe, you can. Thank you.
Excellent, yeah. So I just want to say thank you so much to our speakers who've made this night possible, as well as the support that we've had from RACP. I hope everyone's found it useful. Please continue to engage with the trainees committee. So at Sydney Children's Hospital, there's Amy Wiseman and Zoe Stevenson, and at the Children's Hospital Westmead, there's me and Lucy and Saf. So you can contact any of us or contact through the RACP New South Wales email as well. So we're really keen to hear what your issues are and provide ongoing feedback for you guys. So,
and join committees, get yourself involved in the college. The only way things are going to improve for trainees is if trainees speak up and get engaged.
And I would, as your Director of Advanced Training, I will advocate for you to have study leave and time off. So to go to, not in general, but to go to committees though and these sort of things, because it is so important, as Hala said, you need to be a voice, and if you're not happy, there's no point whinging. Let's, do something about it.
Excellent. So please join me in thanking our speakers.
Please complete your evaluation forms before you go. That'd be great. Thank you.